Hello, can you guys hear me? Can you guys hear me? Are you guys okay? Okay. Okay, I think everything is working now. And I think, Ashley,
Hi,
how are you? Can you hear me okay?
I can hear you just fine.
Okay. What do you think of my fall leaves?
I'm loving it. It's giving me the vibes. I love it. I love this time of the year. So thank you.
It's maybe a little too distracting, but I feel like I need like a little bit of a filter today.
Understandable.
You know how you have one of those days where you're like, I need a filter.
Just about every day of my life, I need a filter. Okay.
You have been so busy. First of all, I'm Dr. Serena Chen. I'm one of the IRMS doctors. It's so nice to see everybody here. There's so many people here. Hello to everybody. Thank you for coming. And it's PCOS Awareness Month, and that's why we're super, super, super honored to have Ashley Levinson here because Ashley Levinson is such a huge fountain of knowledge and advocacy for PCOS, for polycystic ovarian syndrome. Ashley, why don't you just introduce yourself and tell us a little bit about yourself?
I feel like, I inundate people because like I'm during PCOS Awareness Month, I'm just like, wow, I'm all over the place. But for those of you who don't know who I am, my name is Ashley Levinson. I'm known on social media as PCOSgurl. So PCOSgurl. I have to be fancy with the U there.
Yeah.
I have been a 23-year PCOS patient advocate and educator. I have a background in surgical healthcare. I am retired at this point. So that means you get more of me during this September for PCOS Awareness Month. And I work with community outreach with PCOS Challenge, the National Polycystic Ovary Syndrome Association. And I'm so thrilled to be here with my fellow advocate, educator, comrade. So great to be here with you.
And friend, I feel like, how long have we known each other, Ashley? For years now, I feel, and we really, I feel like done some really great work together for raising awareness and educating and going to Capitol Hill and talking to
Absolutely.
people about access to reproductive care and PCOS. So I guess we had a few questions today. So we definitely want to thank you everybody for like reaching out and sending us your questions. But I feel like you have a big month coming up. So I want to give you a chance to tell everybody like about the highlights coming up this month because if you think you might have PCOS or you know somebody who has PCOS or thinks they might, it's like PCOS Academy with Ashley this month.
It is. And I think I wanted to dive into a little bit about why this is so important because PCOS affects approximately up to 26% of patients worldwide, or 1 in 5. It's not particularly in the US, but there are some countries like Australia and India where it's up to 26%, which is
Wow.
astounding. Yet about 70% of patients remain undiagnosed. There are a lot of providers that still don't understand PCOS, so diagnosis doesn't always come easily. On average, patients see 2 to 3 doctors over a 5-year period before they get diagnosed. A lot of times, if patients aren't trying to conceive, the symptoms of PCOS may be overlooked or dismissed or considered not important. So that can delay a diagnosis. But it's important because it is an endocrine syndrome that affects women hormonally, metabolically, reproductively, and psychologically. So it impacts pretty much every bodily system that we have. So it's important that we get the information out there. So PCOS Awareness Month is every September, and we have a couple events. One that just passed, which was amazing, which was World PCOS Day, where organizations and people from around the world got together in solidarity to talk about PCOS around the world and what we need to do to change and impact awareness and education and funding. And we had 200 light up in teal for World PCOS Day. So that was pretty amazing. Thank you to PCOS Challenge. And I have to say a special thank you to Ginny and Charmaine, who were the faces behind the scenes getting all of that to happen. Also during PCOS Awareness Month, I'm going to be doing lives like I'm doing with Dr. Chen right now, all throughout the month to educate people about PCOS. We have the PCOS Symposium coming up. The first date is, I believe, this Saturday, September 10th. We have, what else do we have? We have the
I'm going to be
PCOS
there.
Challenge.
I'm doing, I think 11 o'clock, I'm doing a panel. So I
You're
hope
doing that
people
at
will join.
11.
Yeah.
Oh, I'm sure they will. We still have time to register, gang, so make sure you register for this.
Yeah, so follow
we also have,
Ashley, PCOSgurl. So
right.
tons of information.
Tons of information. Also have links for the gala and the 5K in Philadelphia coming up. So definitely check all of that out. There are ways to get involved and get educated. But Dr. Chen, one of the things that I know we talked about that you wanted to talk about and I wanted to talk about is with PCOS, a lot of people don't realize that there have been some changes that are limiting access to care.
Yeah. And it's this whole thing with Roe v. Wade and the Dobbs decision. People unfortunately are focusing on thinking it's just only about restricting access to elective pregnancy termination. And what we're seeing with a lot of these laws that are passing with the overturning of Roe v. Wade is that we're actually impacting normal medical care for pregnant people. And 90% of the harmful things that are coming out of this it's not about like access to elective pregnancy termination. It's more about just access to regular gynecologic and obstetrical care, which seems a little bit crazy. But what a lot of these laws end up doing is saying, that a doctor for taking care, doing normal things for a pregnant person that they would normally do, could end up in jail. And that's kind of like saying treating appendicitis is illegal now if you don't know for sure that this person is going to die from appendicitis. And normal medical care, what we do is we try to dramatically lower the risk of death, and we try to lower the risk of complications. So the way we approach appendicitis is to say, well, we weigh the risks and the benefits, and a lot of people we take to the OR when they're still stable, they're still relatively healthy, the surgery is relatively uncomplicated, and that's normal medical care. So, and what these laws are saying is wait till the appendix, it's similar to saying wait till the appendix bursts, and then the person gets super, super, super really sick. And then you think, oh, definitely we could prove in a court of law that they were going to die if you don't go to the OR, and then rush to the OR at the last minute, which really does put you at increased risk of death, because most pregnant patients tend to be younger, and younger people don't show signs of impending death very easily. They really have to be super sick to show something significant that would hold up in a court of law. And you're increasing complications. Like, think about if you take out an appendix that's a little bit swollen, it's a small incision, easy surgery, but if you wait till it bursts, you could have to cut the whole belly open, and infection, and take out pieces of bowel. And that's the same thing with pregnancy care. If you treat, let's say, a missed AB early before the patient starts having heavy bleeding, then you don't end up with a patient that needs a blood transfusion, or like ends up in the intensive care unit because she got super, super infected things like that. And not only does that obviously create lots of long-lasting issues, it increases the risk of death, increases the risk of complications, increases the cost of care to the system. And we are creating a situation that's really hostile for doctors. Like, we already have a doctor shortage in this country. And if a doctor is worried that they're going to be thrown in jail for doing the right thing, I think that doctor shortage is going to get worse.
Right. And that can profoundly impact patients with PCOS. And I'm going to tell you
Yes,
all
let's
why.
go through that. I think we have to give
Let's talk about
concrete
this.
examples. Yes.
Yeah. I'm going to give you a couple of examples. I mean, first of all, patients with PCOS are at increased risk for things like miscarriage, for things like
Yes.
ectopic pregnancy, our hormones. So, a lot of people opt to do like IUDs or birth control pills. Infertility, PCOS is the number one cause of female infertility, and that comes from the CDC. So don't just count on me. That comes from the CDC.
Absolutely true.
So you have all of these issues. So when we're talking about access to care, it's not just a debate about, like you said, termination of a birth. We're
Right.
talking about all these other complications that can occur. And what happens is abortion medically is used as a term to take care of a lot of these things like miscarriage,
it's any
ectopic pregnancy.
removal of pregnancy tissue. So I think in the lay public, they think of abortion as, oh, I just decided this is not a pregnancy that I want. So we call that elective termination of a viable pregnancy. But most of the time, the abortions that doctors perform across the country are just removing pregnancy tissue because it's causing a health issue for the person carrying the pregnancy.
Right. Now, as a patient with PCOS, I unfortunately dealt with two issues that could and did impact my health. One was a miscarriage, which I couldn't completely handle on my own, and I needed help, or else I would have had major health complications. And if I didn't have access to that care, I could have died. Number two, I had an ectopic pregnancy that became an emergency. I was fine one minute, then the next minute I was in the ER, and I was being wheeled up to the OR like right away. If I had to wait for a decision to be made before a doctor could give me the care that I needed, again, I would have died. So
even without these laws, just in our routine normal medical care, even without all these laws that are passing now, ectopic pregnancy is still the number one cause of death in pregnancy in the first trimester in the United States. It is still a very dangerous condition today. It affects 2% of all pregnancies. So it's a serious issue.
It's significant. And then, I mean, if we touch on the fact or the point of using devices like an IUD, which, birth control pills aren't always an option for everyone with PCOS, and they might do an IUD, but an IUD, am I right, Dr. Chen, that can also be considered interrupting pregnancy and might be taken off?
Not think that an IUD actually works by interrupting a pregnancy, but that's the thing about a lot of these laws. They're not necessarily based upon scientific knowledge or accepted medical facts. A lot of these laws are based upon conjecture. So, and it's not clear to me why, if you want to restrict elective termination of pregnancy, why you would also restrict contraception. But a lot of these states that are passing these laws are also restricting contraception. And of course, for PCOS, we need contraception to prevent the higher risk of cancer of the lining of the uterus. That is one of our #1 tools that saves people's lives and prevents cancer in PCOS patients, because you have this higher risk of cancer of the lining of the uterus and also higher risk of the ovarian cancer as well. Not as much, but the birth control pills and the IUD and other hormonal contraceptives are used to prevent cancers in a lot of people.
Yeah, and what about, I mean, because here's another issue. You talked about the increased uterine lining, because a lot of times patients with PCOS can go months, even years, without having a menstrual cycle, so that that endometrial lining can build up.
Yes.
What happens in the case where somebody comes in that might have abnormal uterine bleeding or have that really thick endometrium and they need to have a DNC? Is that something that's affected by all of this as well?
Theoretically, it's not supposed to be, but we are seeing like a lot of downstream effects because people are really scared of being thrown in jail. So a lot of people are seeing an impact, like people who have rheumatoid arthritis who need methotrexate to treat their rheumatoid arthritis are being denied methotrexate for their rheumatoid arthritis, even though this has zero to do with pregnancy care, because sometimes methotrexate is used to treat ectopic pregnancy or an abnormal pregnancy, mostly ectopic pregnancy. So, and it's a great way to treat ectopic pregnancy because you can really avoid all the costs and the pain and the suffering and the risks of going to the operating room. So methotrexate is a really wonderful drug for that. And it can also be really, really helpful for rheumatoid arthritis. And so that's something that makes zero medical sense. And yet we are seeing all across this country, pharmacists really fearing for losing their licenses or landing in jail for participating or causing a miscarriage, even though it has nothing to do with pregnancy care. So I do think that I would not be surprised if we saw people getting confused about that and saw people being harmed by that kind of confusion, because there's a lot of confusion out there because these laws are written in a very odd and crazy way, and the legislators, they never, most of them never went to medical school, and even normal medical care can be really challenging. Like it's a big deal to take a patient like yourself who really wants to have a family and try to figure out, where is this pregnancy? Because I know this is a pregnancy you really want. So I have to be really, really sure that this is not a normal pregnancy before I can treat you. And yet this pregnancy could increase your risk of death. So that type of decision making is very challenging for physicians. And we often will conference with each other and review charts. It's not like an easy, clear-cut slam dunk. We treat everybody as an individual. And to have to like then pull in, some lawyer to try to interpret the law when you're just trying to do your best to take care of the patient, you can see how even just that is enough to create issues in medical care.
Right. So let's talk about something that should be a little less controversial, but has become extremely controversial, is IVF. Again, we talked about patients with PCOS, #1 cause of female infertility.
Yep.
Where does that leave us? I mean, what options do we have? Because even that can be interpreted under the laws, and we have to follow stringent plans or have to make decisions that we shouldn't have to make with just trying to start a family. So
I know
what do we do?
It's crazy. This is where we are. We do probably need state by state and maybe national legislation that specifically protects IVF and reproductive care and contraception and pregnancy care, because the way these laws are written, it's very vague. Right now, it does appear that in all the states of the union, right now, knock on wood, it looks like IVF is legal. I would urge everybody to follow fertilitywithinreach.org, resolve.org, and asrm.org, and doctorsforfertility.org, so you can stay up on exactly what's going on. because right now, IVF is not illegal in any of the states, but we are skating on thin ice. There's some states that do outlaw doing anything with a pregnancy that starts at conception, and that some people worry that that could be interpreted to involve an IVF embryos in the
Yeah.
lab. And a lot of these laws say pregnancy in the uterus. So the lawyers feel like, okay, for now we're kind of safe unless somebody decides that they're going to take you to court, which is why we need very specific legislation, very specific protections. Even in New Jersey, we're going to work on getting specific protections. Governor Murphy has passed specific protections for patients to have access to reproductive care, to contraceptive care, to pregnancy care, and we want to add IVF to that bill. And he has also a second law to protect healthcare providers, so that if you're taking care of somebody that needs pregnancy care and they might be from another state, like say a state like Texas with vigilante laws, cannot prosecute a doctor in New Jersey for just taking good medical care of a patient that might have come for help from Texas. A lot of states are passing these types of laws. There's a lot of work to be done, and it's hard now because every single state is different, and that's because this federal protection protecting your right to make these decisions, the Roe v. Wade, has been overturned. So we have lost federal protection for healthcare autonomy, healthcare decision making from both the doctor side and the patient side. And it seems to be, it's focused around pregnancy, but I feel like this is a threat to all of healthcare. You know, this does not just affect OBGYNs, it affects all physicians. We really cannot be throwing physicians into jail for just providing normal medical care. So we are, you know, we're all hoping to like gather together, to work together to let people know, because I think we know that most people want to protect the right to make these healthcare decisions, whether they involve reproductive care or other types of healthcare decisions. It's just that I think a lot of people have been apolitical because they always assumed that as Americans, you know, we're not going to worry about our healthcare. Don't we have the best healthcare system in the world? Aren't we the land of the free and the brave? So we have these choices. It's turning out that a lot of these laws are changing the land of the free and the brave and are changing this healthcare system. So it is turning into a voting issue. And I think, you know, I'm so glad people are here listening. And, you know, I hope you'll talk to your friends and follow PCOSgurl and follow IRMS and me, Dr. Chen, and all these wonderful organizations, so you can really stay up on things. Right now, we're fighting for to protect IVF and reproductive care in South Carolina. The senators are discussing that this week, and I'm not sure what happened today. The House passed a bill that really would just create total chaos in the healthcare system, and might impact IVF care as well. And so we really want everybody, if you know anybody in South Carolina, or everybody in South Carolina, to, you know, call your senators and call the governor, because we don't want it to pass the Senate, and we don't want the governor to pass it. I don't think they realize all the harm they might be doing.
No, and that's why it's so important, like you said, that there is a partnership. And that's really kind of one of the points of doing PCOS Awareness Month is that we have to advocate. We have to share our stories, share our experiences, not just our medical professionals, but us as patients. A lot of times, you know, Serena and I will both tell you, a lot of times, because we've been on Capitol Hill, I don't even think I can count how many times we've been on Capitol Hill, you know, for infertility and for PCOS. And the thing that resonates mostly with these legislators are the patient stories. They want to hear
Yes.
from their constituents. They love hearing the facts and the figures that, like advocates like myself and the information that Dr. Chen provides. They love hearing that. But the thing that's going to make or break a decision is the patient story and patients getting involved and telling them, I don't want this, or I do want this, or you have to do this. I'm in your district, and if we don't get this done, then these people aren't getting the care that they need. We have to hear those stories, not just on Capitol Hill, but also, throughout PCOS Awareness Month. If you are dealing
Absolutely.
with infertility or having problems with access to care, you know what? Put it up on social media. Tag me. I have given over my feed to the community for the month of September. I put a few little things in, but mostly I've been reposting patient stories because that's what needs to be heard to make
And we
change
are
happen.
seeing more awareness and more attention and some more funding for this disease that affects millions of people worldwide because people have spoken up and said, I'm a constituent, I suffer from PCOS, and I want you to know my story. I want you to support PCOS Awareness Month. I want you to vote for more NIH funding. People often think like our government is really big and impersonal, and as an individual, we don't make a difference. But you and I have both seen very, very real, big differences from just our little voices, right? We've gotten a lot of legislation passed in New Jersey. We've gotten a lot of funding for PCOS in DC. We have a lot more work to do. But a lot of really amazing things have happened. So I want everybody to know that your voice really does count. I've even had some friends who don't live in South Carolina who just have been calling South Carolina senators and saying, listen, I'm a patient, I'm a doctor, I work in IVF. This is not good. People are not going to be able to build their families if you pass this. Please listen to the story. And the senators are listening. They want to know what people think. And if people don't speak up, they're not going to know.
Absolutely. And something, things like this also transcend party lines. So don't think that, if you're a Democrat or a Republican or you have, the opposite legislator that you can't talk to them.
That makes it, actually very interesting because Dr. Stephanie Guston in Nebraska and Dr. Abby Delaney, they're both part of doctorsforfertility.org. They just got together a whole bunch of patients. They set up a Facebook page. You can send your story to doctorsforfertility.org. You can also send your story to resolve.org. Collecting stories. There's Save IVF Nebraska, Save IVF Texas already set up. We're working on setting all these up all over the country. But she just took these patient stories and, the doctors, IVF doctors went around with a bunch of patients and they talked to people who were Republican and Democrat, people who are staunchly for this law in Nebraska that would have outlawed IVF. And a lot of the senators were like, I see what you're saying. You build families. I don't want to stop Nebraskans from having access to IVF. Maybe I shouldn't vote for this law the way it is. And they actually stopped a special session that the governor had designed to pass the strictest abortion law in the nation. So they stopped them from voting. And, they made a difference. It was only a handful of people, but they did it. And so it's very Kansas, and Kansas is a very red state. And they were the Republican Party was trying to overturn the constitutional right to abortion. And there's a lot of Republicans in Kansas, but a lot of Republicans decided, I'm going to vote against this because I don't want to lose my ability to make healthcare decisions. And Kansas is a very red state, but this bill to get rid of access to abortion procedures was overturned by a huge margin, mostly by new registrants, mostly by female new registrants, because they realized this is going to affect my normal medical care.
Yeah.
And
Yeah.
so I think I want people to, to not to panic, but to be concerned. Don't ignore this. Don't opt out. Speak up. You can get involved without a lot of time and effort. Just connect with these organizations, and I'll put everybody's handle into the show notes. Um, because we feel like all working together, our voices are all pro good healthcare. I think everybody, no matter what party they're on, can get behind good healthcare access.
Absolutely. I
Right?
agree with you. And it needs to happen. And again, guys, don't be intimidated by somebody who is, when we say we talk to Congress or legislators, because they work for you. And I always say the most powerful tool any of us have is our voice, which Dr. Chen was just saying. So use that voice. I'm no different than any of you that are watching this or may watch this, or, you know, I have no superpower, no special connections. What I do have is a passion for people and a passion for healthcare and a passion for ensuring that my daughter doesn't have to go through everything that I went through in trying to get a
Yeah.
diagnosis and have the best care practices possible. So, that was my driving force, and that happened 23 years ago, and I'm still here
Yeah,
advocating and
and
speaking
you've
up.
already made such a big difference. We do have more to do, but you've already made such a big difference. I want to make sure that I answer some of these questions that came in,
Sure.
because we got some really nice questions that came in. And let's see, this is from Katie Broom
Katie. Mhm.
0H. What are the differences in fertility treatment for lean PCOS versus regular?
Okay. Do you want me to answer that a little bit,
Yes,
or do you?
I want
Okay.
you to go for it.
Okay.
And then
Honestly,
I'll
there
follow
really
up.
is no major difference because every treatment should be, I shouldn't say is, but should be individualized. That means that, whether you're thin or overweight or regular size, that your hormones or your symptoms may be different than the next person. So I don't think it's so much a lean versus uh, normal weight or
I
overweight
agree.
person.
It's like a spectrum. Yep.
It's a spectrum, and it really depends, and it also depends on what your goals are, as far as do you want to do something more natural with supplements, or are you all in and okay with using medications or going the route of doing IVF? It really depends on where you want to be with things, and I'm sure you can add more to that.
I totally agree. I think obviously when you have lean PCOS, theoretically your normal weight. So the weight is not as much of a challenge, but that can be tricky because when you're lean, you can sometimes be tricked into thinking, oh, my sugar is fine. But lean PCOS definitely has insulin resistance, and you still have to treat your body the same way as obese PCOS, overweight PCOS. You still have to avoid sugar, eat a lot of veggies, try to get good sleep. Those things are still important, and your risk for gestational diabetes is still increased. So, lean and non lean PCOS seem different, but there are so many things are the same, and a lot of it is about overall health. And as Ashley said, that's exactly right. What are your symptoms and what are your goals? What is bothering you the most? Like a lot of times I'll have people coming in with complaints about hirsutism, but they want to get pregnant, and I can't really do both of those at the same time. So we have to talk about, the pros and the cons and figure out what really makes sense for you. And this is where, that our healthcare system, we're like, we have a limited amount of time with you. So that's why stuff like this, where you're connecting with good sources of information and understanding, what PCOS is about, so you can ask the right questions, really makes a big difference. Your own knowledge about PCOS, your own body, advocating for yourself, taking the time to make the appointments and talking with the doctor, realizing that it's a journey, all of those can make a huge difference. The overall thing to remember is fertility treatment has a really good prognosis. PCOS patients tend to have a lot of eggs. So I honestly feel like I can make a baby for most PCOS patients. You know, maybe it'll be easy with just like letrozole, or maybe it'll be a little harder with IVF, but PCOS patients tend to have a really, really good chance of having a baby. The thing I worry about more is like things like the diabetes, including in lean PCOS. So I think that's a great question. And then let's see, here's another really interesting one. I like this one a lot, actually. Listen to this. Pros and cons. This is from Nicole Rainey 422. Pros and cons of going on birth control pill with PCOS before trying to conceive with number 2, especially greater than 35 years old. So there's a lot of different things to talk about there, right?
There are, and I think that, I mean, that really comes down to kind of the same thing, because with PCOS, with how close are the pregnancies together, I would say, first of all, would be a consideration, correct?
Lots of things to talk about, yes. Like, I wouldn't use birth control pills to say, like, if the interval between births is safe and approved by your OBGYN and you want to move forward, I don't think the birth control pill per se makes you more fertile necessarily. I've seen people be like, oh, you should go on the birth control pill, or you should go on Lupron or something like that to treat your infertility for 6 to 12 months, even though the person kind of, you know, is ready to get pregnant now. So I don't really believe in that part. But if you're spacing your pregnancies out, that's, you know, we don't want you to get hyperplasia or cancer or have really bad bleeding, or, you know, or hair growth or acne or all of those other side effects that you can get with PCOS when you're just, you know, not controlling your hormones. So having, you know, so birth control pills can be really, really, really helpful and useful to optimize your health between pregnancies. Yeah. I'm not sure if I answered Nicole's question. Hopefully that was helpful.
I think that was, you know, one thing on that maybe you can touch on is that sometimes it's recommended for patients to go on birth control pills to kind of calm the hormones down before they start IVF. So I'm not sure if that is something that she's considering.
I kind of like that, but I don't use it more than a month or so. You know, because super long on the birth control pills doesn't affect IVF outcomes, but it can ultimately lead to you needing more drugs, which can be expensive because it just takes a little slower for the ovaries to ramp up. So I do feel like taking birth control pills before an IVF cycle for PCO, it kind of makes the stimulation a little bit easier to handle. So I totally agree with that. But I don't usually do it for more than a cycle or two, you know. Like
that's great. I love that information, because I think a lot of people get confused about that, because they're like, wait a minute, you want me to go on birth control pills to try to get pregnant, and I don't know why. That I think clarifies a lot.
Yeah. And then we have a nice comment from Sandra D. Graka. The metabolic complications are more the concern. Very, very true. Instead of the weight per se. If overweight, there is evidence that even a 5% weight loss can make a big difference. That is super, super true. So you do not have to be skinny to have a healthy pregnancy. And what you want to do is be healthier. And a nutritionist and a good doctor can really help you with that. And Sandra.Graka or Grasa is absolutely right.
Yeah.
Even a 5% difference.
Don't worry, because I just the other day had a live with Sandro and with Tatiana, and I actually made Sandro say his last name so I didn't mess it up. So
okay, Sandro, sorry I butchered your name, but it's so nice to see you here, and thank you for giving us that very helpful comment. I have another question from Michelle B. Freed. Any contraindications regarding types of exercise? I heard HIIT is not always helpful. I don't know. I really like HIIT. I do want to tell you that if you're doing IVF or you're doing ovarian ovulation induction, your ovaries will get a little bigger than average. And when they're bigger than average, there is a twisting concern, a torsion concern. So what we say is, well, I always say, don't bounce your ovaries around. Don't bounce your big ovaries around, you know, treat them gently. So, but you can still exercise. There are a lot of people out there that make people stop exercising. And I think that could drive you crazy. And I don't think it's necessary. I think that's too extreme, but I don't want you to get dehydrated. I don't want you to get overheated. So I don't like, I don't know, Orange Theory, that might be a little too much. You know, where you're driving into the orange zone, that might be a little bit too much. And, you know, hot yoga, I feel like that's a little too much heat. Like you don't want to be sitting in hot tubs. You don't want to overheat yourself. You have to stay really well hydrated. And, you know, the bouncing your ovaries up and down, probably not good. Your hormones just like pregnancy, they make your joints a little bit loosey-goosey. So you really have to be careful with the lateral movements and the jumping. And sometimes HIIT can be a little bit like that. And then the hydration is super important because the hormones loosen up your vascular tone. If you're not well hydrated, you're going to be like, will feel like really not good and woozy. You should talk with your doctor because your doctor knows you the best. I can't, you know, Ashley and I can't give you medical advice here. This is just some general ideas. Don't bounce your ovaries. Don't overdo it. Don't get overheated. Don't get dehydrated. But the really cool thing is that building up your muscle is such a superpower for PCOS girls, because if you build up muscle strength, you are dramatically lowering your insulin resistance. So doing upper body and core with a personal trainer is like a great idea. And some low impact HIIT might be just the trick, because you can do cardio and strength training at the same time. And building up good muscle will help protect you from gestational diabetes, will help you carry that baby, will help you deliver that baby, will help you recover from childbirth. So like, it's a great thing. Women have to work a little bit harder than men. You know, men have a lot more testosterone, so it's very easy for them. That's, you know, this is why your guy drives you crazy. Like, he's like, oh, I had 9 donuts instead of 10, and I've lost 10 pounds. And meanwhile, you're eating one piece of broccoli and you can't even lose half a pound. Okay. So the muscle is the difference. You can change your metabolism a little bit by doing that. So I would say, you know, get yourself a really motivating, maybe a really handsome trainer, and go for it.
I love that idea. But yeah, I mean, the whole exercise thing has been a huge debate in the PCOS community, because you have people that are trying to promote one exercise over another, saying, well, if you do this exercise, it's better. Or if you do this exercise.
But Ashley, if you don't like an exercise, what if you don't like it, you're not going to do it.
Thank you. That's the point I was getting ready to make, that any exercise is good exercise. It has to be enjoyable and it has to be sustainable for you. Now, with that being said, there have been things, especially as it relates to HIIT, where, you know, you have people saying that it can stress you out and raise your cortisol levels, and that'll raise your insulin.
You can't overdo it.
Right. But that's with any exercise, and that's what needs to be made clear. Again, if there isn't one exercise that's like a bad exercise.
I don't want to be bashing on Orange Theory. Like, you could modify Orange Theory so that it's reasonable. Everybody is different, and you know, I have patients that love Orange Theory, and it's fine. We just talk about, you know, how to adjust a little bit. So
sure.
I totally agree, Ash.
Totally.
People have to enjoy their exercise, and HIIT is actually nice because it's very efficient. Like, if you're not into exercising for hours every day, HIIT is actually a very efficient way to get good cardio. So I would just talk with your doctor about it and come up with a plan that makes sense for you.
Definitely. And there are also, I don't know if people know, but just to put this quick resource out, and I'll put it in my information, but there are quite a few PCOS personal trainers that have PCOS and that also train, like Emma, Ginny, Erica, Volk. They all, this is their life's work. They work with the PCOS community. So reach out to
And
them.
they can be, you can connect with them virtually, right?
You can connect with them virtually. They have accounts on Instagram, Facebook, Twitter. So I will get those links out to everybody, but
You
definitely look
are
up the
a
personal
wealth.
trainers.
You are a wealth of resources. So maybe you'll
I'm the
text me and
PCOS
I'll stick it in the show notes, okay?
Terrific. But yeah,
You're
I
just
mean,
amazing. So
no, you're amazing. I'm so grateful that I've been able to work with you for all of this time
me too,
to make a
Ash.
difference in people's lives. I love
Right
it,
back at you, right back at
Thank
you.
you.
Like it's just it's been wonderful. Um, oh no, Sandro, no more donuts for you. No, no.
Fish
Sandra,
tacos, maybe. Fish tacos, maybe, Sandro, but no donuts.
Ash, let's take a picture of ourselves because I think we look happy. And
We do. Because we're
this has been
together.
so
So,
nice for me.
yeah.
Yes, it is. It is so nice to be here with you. And but I'm sure we'll be doing another conversation again soon. But please, you guys, gotta check out PCOS Girl Ashley on Instagram because she has so many great events coming up. And you're gonna like by the end of this month, you're gonna become like a PCOS expert. You're gonna have so many resources. It's gonna be amazing.
They might be an expert, and I'll probably wind up being cross-eyed with my hair sticking up, but that's okay.
I don't know how you do it.
Whatever
Ash,
works, you know?
Ash, thank you so much.
Thanks.
Big kisses.
Thank you. Thank you. Thank
Have a
you.
great
Love you.
day.
Talk to you. Bye.
Love you. Bye.